Lagging vaccination rates in some states are threatening to widen an already large divide in America. In states like Michigan, vaccination rates are high and COVID restrictions are being lifted next week, 10 days ahead of schedule. And in southern and rural regions where rates are low, people remain at risk for infection. So for more on this, let's bring in Dr. Bob Lahita. He's the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Always good to see you, Doctor, on this lovely Friday. You know, some people are still really concerned about getting the vaccine and the side effects. Most people I spoke to, I was one of them, you know, you kind of had a sore arm, and I felt a little bit under the weather, but I have spoken to other people who were really sick for a bit. And, you know, that makes people nervous. So what do you say to people who are concerned that, you know, they might end up under the weather for a few days if they get the shot?
Well, Anne-Marie, I always said that it's better to be under the weather for a couple of days than to be under the ground for a couple of millennia. You will not die and you will not be in the ICU if you get the vaccination. The problem here is that people are afraid of these minor side effects. And of course, I agree with you that there are certain people who get very, very bad reactions. But it's like, you know, biting the bullet. You really are going to be so protected and so able to socialize and do things that you haven't been able to do for the past year and a half when you get vaccinated.
And another issue, Dr. Bob, is people who don't return for their second dose of the vaccine. A study out of the UK found that one Pfizer shot is only 33% effective against the rapidly spreading Delta variant, which was first identified in India. So why is it so important for people to go back for that second appointment? Just put a fine point on that.
Yeah, because the Delta variant, which is highly infective and highly transmissible, is you only have 33.5% protection after that one shot. I have a list of all the vaccines and the data developed every day, and it seems that that one shot from either the Pfizer or the Moderna is not protective, not fully protective against the Delta variant, which is very dangerous. And so people ought to know that. So go and get your second shot. The one shot, there's a lot of research going on for the AstraZeneca and also the J&J vaccine. The AstraZeneca not being approved here yet, but the J&J vaccine, we don't really have data to see whether that is protective against the Delta variant.
There's another study out of the UK, doctor, that suggests the potential for some long-term brain tissue loss after COVID. Can you explain why that might happen and the effect that it could have on a person?
Yes, Anne-Marie, this is very disturbing to me. The virus is neurotropic, and I have said many times that there's about 1,000 times more COVID virus in your brain than in the rest of your body once you're infected. Well, now there's data, and I have to tell you, the study is magnificent. I read the data, and I looked at the brain scan photographs. It seems that this virus, which is neurotropic, which means it prefers nerve tissue, that when it goes into the brain, it causes these microemboli or microclots to form in some of the vasculature, and it also directly kills neurons. So here we have the loss of taste and the loss of smell. And if you have that after the infection or during the infection, it simply means these nerve cells in certain parts of the brain responsible for that aspect of your brain are dead, and they may never come back. Many people get their taste and smell back, but there are a lot of people out there that I see that have never regained their smell and their taste. And God knows what else has been lost in your brain because of this infection.
So, Dr. Bob, let's talk about travel. I was telling Anne-Marie earlier this morning that I had a freak-out moment yesterday when I was at the gym because, as we've been discussing, in New York City, you can now go to a gym. There are no restrictions. They do recommend that if you are not vaccinated to wear a mask, but it's on the honor system. Everybody's walking around maskless. Everybody's huffing and puffing and sweating all over the place. And I had this moment where I thought to myself, next week I'm going on vacation. It's the first time in nearly 2 years that I will see my family, my brother-in-law and my nephews and my sister-in-law, and we have to all be tested before we travel to this country that we're going to. And I just thought to myself, I know that I won't get sick. I know that I won't end up in an ICU, but man, how shattered would my life be if I test positive only a few days before I get on this plane to go to this trip, and I can't do that. And that means that it's not a medical situation. It's more of an inconvenience. People on this set would have to be quarantined. People at CBS This Morning might have to not be at work. So remind our viewers, put my mind at ease again, if you are fully vaccinated, and let's say you do come into contact with someone who is unvaccinated or asymptomatic with COVID-19, what are the chances of getting infected?
The chances of getting infected, Vlad, from other people who are vaccinated are minimal. If you have not been vaccinated, your chances of getting infected are pretty high. And you know, the cruise industry has lowered the risk to 3 from 4 for those who are unvaccinated, because the majority of the crew members on any ship or a plane, the flight attendants, all have to be vaccinated. But we advise against cruises or flights for those who are not vaccinated, because it's a closed environment. You know, you're in a small space with a lot of people. So you usually test 3 days before the departure. If you test positive, you don't go anywhere. You stay home. You quarantine yourself. But most important, and this, people never think about this, get travel insurance in case when you're at this foreign country, you come down with the virus. You want to be able to plan for the hospital that you're going to be placed in abroad. You probably will do okay in that hospital, but we don't know anything or very little about medical care in other countries, and you want to make sure that you're protected. If you do test positive, remember social distancing, wear the mask, and wash your hands a lot. I would do that even if I was vaccinated and was of little, I didn't have a lot of anxiety about getting infected, Vlad.
So you think I should wear a mask even if I'm at the gym because I'm vaccinated and I don't know if other people are?
That's right. I advise everybody in closed spaces, when you're really close to people, and you know how it is in the gym when you're on the treadmill or the elliptical and everybody's sweating, grunting, yelling, screaming. You just don't know who in that gym has been vaccinated, who is antigenically
You're freaking me out,
positive.
Dr. Bob. You're freaking me out.
Excuse me, what gyms are you two gentlemen going to? Sounds obscene.
Oh, man, I'm worried.
Listen,
right.
Dr. Bob, this is really quickly before we have to let you go. There's talk of development of an antiviral pill to treat COVID. What can you tell us?
Yes, there is development of an antiviral pill. So far, most of them have been a disaster. There are several pharmaceutical companies working to produce an enzyme inhibitor against the replicase enzyme, which is what the virus uses to double itself in cells. And, you know, we have it for hepatitis C. We have it for influenza. We want it to be an oral pill that we can take for COVID-19, particularly when your symptoms first come on before you go to the emergency room or wind up in the hospital. That's what's in order right now, Anne-Marie.
All right, Dr. Bob Lahita, thank you very much.